Ladies and gentlemen, it is my honor on behalf of the government and the people of the Republic of Sierra Leone to greet the distinguished participants and also express my sincere appreciation to the organizer of this important and timely symposium. As we all know, since the outbreak of the Ebola epidemic, it has seriously crippled the socio-economic life of our people in West Africa. The following cumulative cases have been reported so far in Sierra Leone. We have got 3,005 cases. Kailang, 537. Kenema, 459. Kono, 34. Bombali, 403. Cambia, 25. Kwenadugu, 2. Podloko, 225, Tonkolili 138, Bo 143 cases, Bonth 2, Bayamba 80, and Pujang 24. In the western area alone, that is Freetown, the capital, and the neighboring commune, we have recorded about 733 cases. That is the capital, which is very dangerous for the country. The cumulative deaths so far, as reported by the government of Sierra Leone, and even by World Health Organization, is about 943 deaths. Since the index case in Sierra Leone was recorded in May this year, after the first case appeared in neighboring Guinea in March, and subsequently in Liberia, the government of Sierra Leone, in collaboration with the development partners, has continued to mobilize and deploy resources to contain the spread of the virus. In its response to the crisis, the government set up coordinating mechanism with World Health Organization, Medicine Sans Frontières, UNICEF, and other international bodies. It also set an ministerial committee to mobilize ministers, departments, and agencies behind the initial 6-month comprehensive strategy with a view to coordinating support activities and other extraordinary measures required to contain and control the spread of the epidemic. Accordingly, the launch of the 60 to 90-day accelerated EVD outbreak response plan in July, in collaboration with WHO, MSF, generated intense awareness and the need to address the gap in the financial resources required to support the response plan. A state of public health emergency was declared in August to create space for the extraordinary measures necessary for quarantine epicenters of the disease, restricting public gatherings, introducing and enforcing new barrier protocols through the country. Additionally, measures were put in place to create awareness about the disease by local government authorities, religious leaders, NGOs, CSOs, musicians, market women, traders, and media, and the general public. An important aspect in the application of control measures was the surveillance and contact tracing, which is vital to containing the person-to-person transmission of the disease, particularly in the view of the nature of the community setting and close social and personal interaction in existence in Sierra Leone. Considering that the disease had merely engulfed 3 out of 4 countries, excluding Côte d'Ivoire in the Mano River Basin, are taking into account our responsibility to prevent its international spread, the government of Sierra Leone undertook a coordinated approach within the framework of the MRU and ECOWAS by convening a summit-level meeting on the 1st of August 2014. Among other things, we agreed on the measures to not only manage the containment of the disease, but also, importantly, to prevent its international spread through robust exit screening at airports and borders. These measures also require the support of the international community, particularly to help build the capacity in the fight against Ebola. Although there has been some positive response to this call in terms of financial, medical, and logistical support, the region is still overwhelmed by the immense challenge of acquiring human resource and other resources needed to combat the disease. If not addressed soon, new cases will gallop above the current figure, which is currently above 4,000 in the sub-region. After the summit, the government of the Republic of Sierra Leone took appropriate steps to address some of the concerns expressed by the general public and other development partners by taking the following actions. Enhance the capacity of the holding centers spread across the nation by providing additional hospital beds, staff, and equipment. increase laboratory capacity to test and report on specimens to facilitate timely confirmation, procured additional ambulances and vehicles for increased logistical support, procured additional supplies of personal protective equipment and supportive medicine to health facilities, recruitment and conducted Ebola-specific training cadres of health workers, and increased and expanded the capacity of an emergency call center. About a month ago, the government of Sierra Leone took an extraordinary measure asking the people to stay at home for 3 days for a national house-to-house sensitization, monitoring, surveillance, and contact tracing exercises. The objective of this house-to-house, host-to-host campaign were as follows: to reach 100% household with correct information on Ebola. Government has also stepped up more effort to screen people at the airports traveling abroad. You are aware of the recent reports on cases of Ebola in Europe and USA, which has warranted more intense screening at the airports. More treatment centers have been established in Lakal, Hastings, Kenema, Kailang, while testing and holding centers are in the Chinese hospital in Jui. To summarize, I will summarize with the words of the AUC chairperson, Dr. Kusana Dlamini Zuma, during his statement in a high-level meeting on the Ebola response at the UN General Assembly in New York on the 25th September 2014. The occurrence of Ebola in the countries that have just emerged from conflicts and are still rebuilding the public health system, as well as public trust and social cohesion, makes this a huge burden. It has a severe impact on health workers and women who are at the front line of the disease in these countries. It also adversely affects children who are often left orphaned with no family to care for them. That is exactly the stark reality of the situation. Economic disruptions are already being felt. Inflation has been reduced to single digit for the first time in 5 years. I pray, therefore, that this symposium will create the required impact to galvanize international solidarity to roll back the disease in West Africa. I thank you.
Merci. Oui, allez-y.
Je m'excuse, c'est vous signaler aussi la présence dans la salle d'un directeur général de Bruxelles Airlines, que vraiment il faut applaudir parce que Bruxelles Airlines a eu le courage. Bruxelles Airlines avec Air France et Royal Air Maroc sont aujourd'hui les 3 compagnies qui, malgré tout ce qu'on dit, on dit qu'ils continueront à desservir nos capitales. Nous leur disons grand merci. Merci beaucoup.